Hey everyone, I'm Stephanie Tsai, back here in the Toyota Solutions studio at Women in the World 2018, joined now by another Toyota mother of invention, Ting Shih, who created a really innovative technology company bringing medicine to the masses. The company is called ClickMedix, and she is the founder and CEO. Ting, it's great to see you again.
Good to see you again.
How have things been in the last year for ClickMedix?
It's been amazing growth. We're looking at entering 4 new countries: UK, South Africa, Kenya, and Brazil. All the places that really have need for healthcare and chronic disease management. We're coming up with some new products, including artificial intelligence chat agent and machine learning for all the data sets that we have.
Wow.
We're trying to create a village clinic that's as low as $5,000 and it's self-sustaining within a year.
An actual brick and mortar clinic.
All you need is a set of equipment and a tablet. Put it on a table, there's your clinic.
Wow.
We're rolling this out in village schools in India first and other villages, and it really can be anywhere.
Slow down, because each of those things I kind of want to unpack. Let's just back up for a second so everybody understands what you do, because you were tasked at MIT, from what I recall from a professor, to design a project that would impact 1 billion people.
Yes.
And your idea was to connect people to medical specialists via an app, right? Is that the basic? That's how it started?
Yeah. What we want to do is, while you have patients who can't get to the doctors at the same time can't always get to the patients.
Right.
So we want to empower the doctors and the healthcare providers and all the way out into the health worker who do the home care and home visits to use technology so that they can better reach the patients, better serve them without physically being there.
And it was stuff like you could take a photo of the rash on your hand and then send the photo through the app in a secured, encrypted way, and then a dermatologist from somewhere, even if you were in a remote village where there were no dermatologists nearby, you could get a prescription and a diagnosis.
Absolutely, you can do that in the US, you can do that today.
Wow, okay, so just that alone, that expanded pretty rapidly.
Yeah, we started doing that with dermatologists. We even did HIV staging with dermatologists, and so many places where you needed a visual examination of a skin symptom for various diseases, and that turned out to work so well anywhere in the world.
What countries were you in when you first started?
We were in Botswana, Egypt, Uganda.
So you specifically identified places where there was a lack of health infrastructure, I assume. And then where were the providers? Were the providers in country, or were they potentially elsewhere?
So a good example is Botswana. They had 1 doctor, 1 specialist in oral surgery. They didn't have any dermatologists, so they had a rotation of US-based dermatologists traveling to the country of 2 million people. You can find very similar ratios in other countries as well. Even in parts of rural developed countries like rural US, you'll see horrible ratios where the specialist is just not in these places, and the wait time could be months, sometimes years. And sadly, a lot of times patients just don't end up seeing the doctor and they get really sick.
So somebody in Botswana who doesn't have access to the certain specialist, would they be connected to a specialist in a different country, potentially?
So there's always someone in person who can actually do the treatment part. Sometimes it's a biopsy or something.
Yeah, because what good is a diagnosis if you can't get treated, right?
Yeah, but you need the correct diagnosis in order to advise on the right treatment. The treatment has to be done in country. So the medication prescription. So we end up building a partnership network in country and remote, combining primary care doctors, specialists, health workers, and patients themselves. You're seeing huge uptake in smartphones. A lot of patients, they have their own smartphones, so they can download the app, they can start engaging after the initial encounter with the physicians.
Okay, so you get the Mother of Invention recognition in 2015. What did that mean for you back then, and could you have grown to what you are today in absence of that grant?
It meant so much to me, just being, all that hard work, being such a cool, creative title. Mother of Invention. I really felt, the whole mission was, how do I invent something to save over 1 billion people, improve their health care? It was such a title that also helped inspire my goals and, keep going. it's really difficult being a female entrepreneur, period. And you know, the title, the award really helped, and the network of other mothers of invention. I mean, each one amazing woman doing incredible things, and we're actually thinking of ways to work together. Everyone needs some mobile technology, everybody needs healthcare, and I think that network is just really incredible. And I think the network, I wouldn't have had access to such inspiring other women in the Toyota network and the publicity that the mother of invention actually brought. I mean, it's tremendous value that money can't even buy.
How do you stay on top of it all? It sounds like you're expanding into some pretty exciting stuff. AI, big data, these are all huge. Were they a part of your original concept, or has it just evolved into that?
Back in grad school, 2017, when we first came up with the concept, even before we were a company, we had thought, with all these data we can collect literally into people's homes, what they're eating, what they're using, what their house looks like. It's incredibly rich to figure out, well, can we then use it to predict what areas or demographic people might have certain diseases? And we're at the point where we have enough of that data, we can do predictions. We're working with universities in the UK and other places to start making those predictions.
What does that mean for your business? Like understanding sort of and being able to predict where you might see a certain disease in a community. What then do you do with that information?
Well, you can then understand that there's a huge demand in the communities. For example, in India, we found 30% diabetes versus 10, which is the national average. We can then ask for, you know, how do we treat this large population? With this much demand, can we then negotiate some discounts? Can the government start programs to help pay for these people? With this ability to project, we can have better treatment regimen. How do you more cost-effectively treat a large population? And that is incredibly valuable. And also on a personal level, if I could tell you, you know, you are possibly going to have diabetes at some point, that would change your behavior now.
Right.
And maybe you actually won't have the disease.
So the idea is not to keep that information sort of proprietary and sell it or something, but to let people know in the community.
Yeah.
You know, you're obviously so technically adept. At what point did you feel like the conviction to help people, you know, the sort of humanitarian part of your work?
I've always just wanted to help people. You know, some people are born evil, some just want to help people.
That's debatable whether anyone's born evil, but okay, yeah.
But I'm convinced. I mean, I don't know. I just want to help people. And yes, I grew up living with my grandparents. I don't know why. They're always going to the clinic. And I think healthcare is just such a big part of what I grew up with and problems.
Healthcare is such a huge thing to solve. I mean, not even this country. The most advanced country on the planet can figure out how to provide healthcare properly.
Right, cheaply to a large, growing, aging population.
Have you thought about doing more in the U.S.?
Yeah, absolutely. In the U.S., we're working workforce healthcare, particularly on chronic diseases since we are aging, and better, more easy ways of engaging millennials as well. You know, that's why at the chatbot product, is literally everything we've done is to mimic what a doctor would have asked of a patient.
How does the chatbot work?
Yeah, so before
is it a real person on the other side?
It's not. So our system has a set of questionnaires that eventually leads you to a possibility of a diagnosis. Okay. We've been doing that manually with health workers asking these questions, but we're adding in a chatbot to automatically ask those questions that shows up on your app, and then you get to a point where you then need a consultation from a physician. But then you're not trying to find 100 doctors to figure out which one can really treat you. You're pinpointed to the doctor who fit your criteria that you can afford to treat what you have.
I guess that's why the bot came in. It didn't really need to ask whether there was a real person. There's still another person at the end of it, but it sort of makes it more efficient.
Exactly.
The initial questions don't need to be asked by a human doctor.
Yeah. It's like the form you keep on filling out in the doctor's office. Yeah. So that part can be automated.
That makes sense. I mean, automation is really interesting. I'm interested in automation and big data and AI and how that's also changing for the better in some ways, efficiency and things like healthcare, but also potentially have downsides. Do you have to deal with the downsides or think about them at all in your business? And obviously what I mean is sort of things like worker replacement or doctors being replaced by AI.
So the good thing about healthcare is such a big problem, it's actually limitless. There's always a healthcare concern. There's always room for improvement in healthcare. I mean, there are not enough doctors. Even if we grew more doctors somehow, we still won't be able to serve the demand of the healthcare needs. And that's why automation is needed. And I think what it's helping is at some point a human comes in, but the human's coming to do a higher level work, like empathy, like, well, how are you really doing, but how can I really help you understand the disease and help you get through it?
Yeah.
A robot, well, unlikely to do that very well, and that's why we're creating jobs for other skill sets that humans are actually better at doing.
Yeah. I know you and I have talked a lot about personally, the influences on your life. I want to go back to Mother of Invention and what that meant to you personally. Was it encouragement? Was it affirmation?
You know, as an entrepreneur, your life is like a roller coaster. It's like highs and lows. Mother of Invention is like, okay, I am inventing something. It's going to be revolutionary. It's not going to be easy. So personally, it's been sort of that, light at the end of the tunnel that I know it's there. There's a sign.
As well.
It's like a sign, you know, and a community. Yeah, and that helps a lot. I mean, there's no entrepreneur support group, is there?
I guess there could be with Mothers of Invention.
Yeah.
I know you had a think tank this year.
Yeah, the think tank was incredible, where we, talked about ways we can help each other, ways companies like Toyota can help entrepreneurs, and how we can do more together.
Is it ever a forum for venting? Challenges and issues that you come up with, that come up as an entrepreneur.
Absolutely. I mean, they are, the stigma, unfortunately, for women entrepreneurs are actually true.
Still.
For some of them, especially when you're trying to fundraise. How do you talk? How do you dress? How do you wear your hair? That's a big lesson right there. And, those who have done it, we shared tips and figure out how to present yourself. It really matters. The woman-man bias is there. It's unconscious or conscious. It's there, and we have to learn.
You've gotten pretty far, though. So I wonder if you, at this point, have some advice for the young entrepreneur and how to close the deal. I know getting the meeting with venture capitalists at this point, it might not be as hard, especially because there's so much focus around the need to bring more women up in the startup world. But what's your advice on closing the deal?
I'd say what I learned during the think tank with other women entrepreneurs is, really, trying to raise money is a money game, right? The venture capitalist is the numbers person. They have a ranking system, and it's whoever brings them the most money. So what you have to say is, annual revenue is going to be, $1 million or more. It will increase by 10, 20%. Whatever number that is, it's got to be better than the next person who's pitching. At the end of the day, it boils down to how much is that venture capitalist going to get back. It is a numbers game, and I think a lot of times, we're so passionate about our mission. We speak so much about it, but it's equally important to focus. At the end of the day, my numbers are better than anybody else's. That's why you're funding me.
That is terrific and pragmatic advice that I think a lot of people will appreciate. All right, well, I am so excited to see everything that ClickMedix becomes, and so grateful that I've had the chance to meet somebody who has it all sort of figured out at this point.
Getting there. Thank you.
Ting, Shih, great to see you again. Thanks for joining us.
Yeah, wonderful.